I'm a medical doctor, don't tend to see patients these days. I've trained in sports medicine, occupational medicine, and run an NHS occupational health department. Trained in CBT relatively early, in the 90s, and now increasingly interested in mindfulness, compassion focused therapy, and what are called third wave CBTs. I think they have a lot of promise. Ran an exercise medicine unit in the 90s linked to an NHS occupational health department, did some cardiac rehab, back pain. So I guess my speciality is kind of behavioural medicine, clinical prevention, behavioural medicine, not a well recognised speciality. Trained in motivational interviewing. I do a reasonable amount of training of NHS workforces in motivational interviewing. Help the Department of Health create the Let's Get Moving physical activity care pathway, training up GPs in brief interventions around physical activity, and also we've been recently working with the National Cancer Survivorship Initiative. More and more people are surviving cancer, sometimes harmed by their treatment, and so a number of prototype sites up and down the country are developing cancer survivorship clinics, and they're using motivational interviewing and health coaching as part of the way they kind of activate and empower people. Did once pole vault for Great Britain and was a contender on Gladiators, but both of those were 20 years and 2 stone ago, but you can find it on YouTube if you look hard. So I established my company Strategic Health Limited to help with the creation of a kind of £12 million healthy living centre in Peckham in 1990s. So that was quite, looking at the original Peckham experiment, the American Medical Fitness Centre movement, big regeneration scheme, and now have a kind of a brand called Applied Wellbeing, and I'm developing health and wellbeing apps and online courses, and then the Academy for Health Coaching is where myself and colleagues deliver training, mainly in motivational interviewing to work, and typically NHS workforces, but I've worked with Bupa and Boots and other people around health behaviour change. Seems to work. Working with a number of different organisations at the moment, including NHS organisations that wish to protect and improve the health and well-being of their employees. One of the things that we know is a dramatic reduction in deaths from infectious disease. Not necessarily due to medicine, maybe due to better health and not having so much overcrowding and washing your hands and stuff like that. Healthcare had a role, but with the growth of scientific medicine and public health, you get an increased number of people living a long time with and without disease, increased burden of disease, and you could argue just a big need to focus on prevention and behaviour, which the founders of the NHS thought that when they'd detected and treated the backlog of illness and disability in the masses, then it would turn this massive resource into prevention, and it never happened. It might do in the future, who knows? Well, no, it's not going to happen, is it, with the current government? Anyway, so the increasing prevalence of long-term conditions is the biggest challenge facing the NHS now and in the future, and not just the NHS. However, so these common chronic conditions, long-term conditions, are growing, and in the States, you're looking at significant increases. Yes, from 10 years ago, but 10 years into the future as well, big increases in the prevalence of long-term conditions. The path to successful healthcare reform goes straight through more effective chronic disease prevention and treatment. You know this. 75 cents in every dollar spent on healthcare in the US is treatment of chronic illness. It's huge. A healthcare system which focuses more on repairing the damage done by chronic disease than it does on preventing both the disease and the damage it causes is no more healthcare system at all. It's a sick care system. The primary driver of soaring healthcare costs is inadequate investment in prevention, health risk reduction, disease management. These programs do not cost too much, but rather it's far too costly not to implement them. Less than 1% of US investment in medical care and biomedical research is on prevention. So what are the causal pathways? Well, lifestyle isn't the only thing, obviously, which causes ill health problems, but it's a major factor. And environment and genes contribute to people's lifestyle. How you live your life influences the risk that you develop a long-term condition. 50 million people with long-term conditions in the UK, 50% of all GP appointments, 64% of outpatient appointments, 70% of bed days, 70% of total costs. Long-term conditions can lead to complications, exacerbations, which lead to admission and death. So that's an understandable causal pathway. Primary prevention It doesn't just involve lifestyle, it involves better housing, trying to reduce health inequalities, increasing access to services. So there's a broad public health agenda. Don't want to get into victim blaming here. Primary prevention is trying to stop people becoming sick in the first place. Secondary prevention, people with conditions, reducing the probability they develop complications or have exacerbations. 75% of deaths in the UK, 4 conditions, and they share 4 common behavioural risk factors: poor diet, physical activity, inactivity, harmful use of alcohol and tobacco use. And the other common risk factors, you'll get this presentation in due course. Sorry you haven't got a handout, should have apologised at the outset. 2 more common: chronic stress, on the news today, so job strain, loss of responsibility, but lack of job latitude contributing maybe increased cardiovascular risk by 23%, and not taking your meds properly. These are behaviours in a way. So it's not just what you take, it's what you do. And people need help. People need help changing their behaviour. So we've got a very nice product which enables people to coach themselves towards higher levels of well-being, built in Moodle, an open source platform containing a range of topics and videos and guidelines. A number of NHS organisations have used it. We have an online kind of health and well-being platform which a number of NHS organisations have bought and made available to their employees as part of their efforts to implement Borman and improve and protect the mental health and well-being of NHS staff. The Borman recommendation is that the NHS becomes an exemplar employer with regard to the health and well-being of its employees. I think it's got a long way to go. And then there's an American company, Talktala, that have developed a very nice online group psychotherapy platform which enables a nice degree of anonymous and participative interaction online for moderated psychotherapy groups, but we're looking to adapt them for behaviour change, weight loss, pain management, etc. So what you've got is the ability of a therapist, a doctor, a nurse, a physio, a personal trainer to welcome people into a group. You can call the group whatever you want. Calling it, you know, your depression group probably is not going to get a lot of people along. Talking about I can't get on with my kids or my partner's afraid of commitment may make it more accessible. So their view is lots of people won't turn up for psychotherapy at $100 an hour. They need to be disruptive, break that model, and they're going to do that by having a group online product where people might charge $10 an hour and a therapist can rapidly create a course. So you've got the ability, the coach, nurse, doctor, physio can control who speaks, you can take turns, you can send someone a yellow card or you can kick them out of the group, and it enables quite a nice degree of participation and discussion. So in terms of self-management support in long-term conditions, there'll be a degree of training involved for nurses, physios, diabetes specialists, etc. But especially for young audiences, for young children and adolescents, the possibility of participating in a confidential group where you may or may not have your image. You can go to video mode. So at the moment this is messaging and text mode, but you can go to video mode and you can take turns. So we think this is quite a nice, secure platform for helping the NHS and other organisations make a transition towards remote monitoring, telehealth coaching and support. Not necessarily for psychotherapy, although we're hopeful that some IAPT services might want to invest and experiment with this technology, but also for cancer well-being, diabetes, chronic pain, etc. Because you know, turning up, seeing someone driving away, you know, huge cost. So we know that from Lean. So I can send you those links. So I'm working with Aquaterra Leisure. We've got shortlisted for Islington PCT's Tier 2 weight loss service. So we're going to be providing a traditional kind of educational exercise-based 10-week structured weight loss program in leisure centres if we win it, but also making available online text, telephone health coaching support for people who want to lose weight in Islington if we get it. So this was the New York Times. What's that? Less than a month ago, 3 weeks ago. Before long, your doctor may be telling you to download 2 apps and call her in the morning. People believe that? Maybe download 2 apps, maybe go use this app and we'll meet in a few weeks' time. But, you know, we'll allow them some rhetoric. So long-term conditions and the viability of healthcare systems. I mean, I don't think that's an overstatement. You look at the percentage of taxpayers' money and healthcare expenditure and long-term conditions, you know, the model is broken. We need disruptive innovations in how we prevent people from developing long-term conditions and help people with long-term conditions not develop complications and exacerbations. E-mediated behaviour change, I think, could be a bit of a disruptive innovation. Thank you for listening, and thank you very much for SATA, because they were kind enough to give me a grant under the ICT programme to help me develop the product you haven't seen here, but you can see, of course, on stand 7 later. So thank you very much. Happy to take any questions.